And I'll share my screen. Okay. All right. So tonight we're looking at dentistry and optometry. And here is the slide with information. Move this over. University of Louisville School of Dentistry and Southern College of Optometry are where our guests attended. Quite a few dental programs, 68. Most of our students end up going to U of L or Indiana's program. Both of these programs are 4 years in length. Average GPA, the information differed, but the class of 2023, the overall average was a 3.61. And whenever you see the term BCP, you know that's going to refer to science and math. So biochem and physics, a little bit lower at 3.49. Whereas for Southern College of Optometry, minimum 3.0, you're rarely going to see people with the minimum. That's going to be more unusual. Class average for 2020 was 3.65. And I thought it was interesting to note they said recent coursework is more significant than coursework completed during students' first year. So that's good if you have a rocky start. They do look at the upward trajectory of your grades. That's really good news. Grad admission tests for both of these tracks, the DAT and the OAT. They are both smaller than the MCAT, but still something you definitely would want to prepare for. And then some differences in program costs. Total fees and tuition for U of L School of Dentistry, $191. Non-Kentucky residents, look at that, $348. And then for Southern, the tuition alone, it would be about $108 total for residents, and then non-residents about $156. Fees are additional, and those will run probably in the thousands. So some differences there. Let's look real quickly. And as we know, these ranges are, you know, just guesstimates. They are averages based on location in the country, where you're at in your career, and so on. So the average, according to ONET, for dentistry, 158.9, in Indiana, 152.7. I do want to note that in the category other specialists for dentists, Indiana actually had a higher number than the national average. National average was 183. Indiana average was over 208. Kind of interesting. According to Explore Health Careers, they show a higher number there. And then for optometrists, the average for ONET, pretty close to the national average as well. And Explore Health Careers seem to have somewhat inflated averages, but this is something that it's tricky to nail that down. But good news for both of them. They have some good job growth in this decade, 5 to 10% growth. So that's really good news. And so here are our guests. They might even be on the call. I told them that I would introduce them at about 7:05. We have alumna, Dr. Sarah Pourhedarian. She's an optometrist in Louisville. She's at the Louisville and Shelbyville locations for Vision First. And then we have a local dentist, Dr. Alex Marty, very accomplished professional. And he's also a business owner. And so that's an interesting feature of what he does as well. So I'm going to stop sharing, see who else on the call. And I see we do have Dr. P. We'll wait. And just a reminder, if all of you could put your cameras on, that'd be great. So we can see that we've got a nice crowd here. So. All right, Dr. Pourhedarian, are you with us? Dr. P? I see you changed your name. Join us when you can. Dr. Jorge Darian,
Hello?
can you hear us?
Yes. Okay. Sorry about that.
No problem. Hello, hello.
Let me see my
There
screen.
you are.
Can you see me?
Yes.
I was gonna say I can't see you. All right. Let's see. That's okay. I don't need to have this screen. Let me see it.
We can see you, but
You can see me? Okay. I
yeah.
can't see you all, but that's okay.
Oh no. I wonder, that's interesting. I've not really had that problem. We're waiting for Dr. Marty to join us. If you want to go
Okay,
ahead.
here we go.
Oh, perfect. You see us now?
Yes.
Okay, perfect. Hello. Can you hear us?
Okay. Hello.
Can you hear us?
Yes. Sorry. My husband has this whole Zoom set up. I know you said this is your worst nightmare, but I think I'm good to go now.
Well, as long as we have you, we are waiting for our dentist, Dr. Marty. But I think I will go ahead and have you begin and have you just introduce yourself. As a Hanover alum, maybe you can talk about what your major was while you were a student, if you had a minor, things that you were involved in as an undergrad, maybe favorite classes, professors, co-curricular things, if you were an athlete or a part of student orgs, whether you did any like internships, externships, that kind of thing. And then maybe just talk a little bit about yourself professionally right now. So,
Okay. Perfect.
and if you don't mind, I'm going to say Dr. P, just because
Yes.
it's short and sweet. All right.
Yes,
Thank you.
fine. Thank you. I actually go by Dr. Sarah, so Dr.
Oh,
P.
Dr. Sarah. Dr. Sarah works too.
So I graduated from, well, I'm an optometrist in Louisville, Kentucky, and I work at a large private practice group called Vision First, but I graduated from Hanover in 2008. I was a biology major and a business minor. So I was a part of the CBP, the Center for Business Preparation, I think is what they call it. So while I was at Hanover, I was involved. I had to kind of think about this. I guess it was Student Senate, not SGA. I liked to play intramural soccer. I was involved in Kappa Alpha Theta. I was actually our service chair. So with that came just being involved in a lot of on-campus activities such as Relay for Life and a lot of volunteer work came from that. In regards to internships between my third and fourth year, I did do some research through Indiana University, and that was specifically with neurology, not exactly related to optometry, but it was definitely a good experience, and that's kind of where I got some of my I think you still do independent studies your senior year. So that's when I did some of that research for that. Yeah. But yeah, that's kind of just a brief breakdown of some activities that I was involved in and my background at Hanover.
Okay. Can you talk a little bit more about that research at IU? Was that something that you applied for? Application process? Did you live up there in Indianapolis?
Yes. So it was an application process. Unfortunately, I can't remember exactly what the program was, but it was paid. And I was there for 8 weeks. And so I was actually working in a lab under a neurologist. So it was an 8 to 5 position. And I was specifically studying neurogenesis, which is the growth of neurons in specific parts of the brain. So it was a lot of lab work with staining and looking at different areas of the brain, and also antidepressant use in certain Alzheimer's patients. So I did that. And also optometry school requires physics as well. So I actually took physics at the same time that
Oh,
summer.
wow.
So that was definitely a busy summer.
Killer, killer. I assume that that was something, though, that you were able to talk about during your interviews for optometry school, that research
Definitely,
that
yes.
came
And
up?
actually, my preceptor wrote a letter of recommendation, and um, so that definitely, I would say, looked good. Having that on my resume and then having that strong letter of recommendation. He was able to see my work ethic, and um, working in a lab, it's definitely a lot more one-on-one. And
Mhm.
so I think that was, yeah, definitely kind
Yeah.
of gave me a leg up.
Well, we talk about gaining different kinds of experience, and certainly the clinical shadowing is huge.
Hmm.
But research is another really good piece for a variety of fields, and we've heard other guests talk about that. Did you personally gain any kind of shadowing before you applied to optometry school?
I did a lot of shadowing, specifically between, for I would say, the same um, point that a lot of you all are in, because within my first year, I thought I knew what I wanted to do, which was go to medical school, but then I started to really question, is this what I really want to do? So that's when I started shadowing, was my second semester of freshman year, just kind of other career paths in the medical field. And so yeah, I would just, obviously, I had some connections with friends, maybe they're who had family members who were podiatrists or dentists. But then also the way that I shadowed, one of the optometrists in Louisville was via Hanover had I think it was what Jen Siepler's involved with. So she just had a list, or at the time, um, just different contacts, Hanover contacts. And I reached out to one of the Hanover contacts that was an
Mhm,
optometrist. And that was actually
mhm.
the first optometrist that I shadowed. So,
Awesome. Okay, that's pretty cool. So can you talk just a little bit? And students, if you guys have questions, let's take advantage of, the Zoom tonight. And if you want to submit them to chat, I'll try to pay attention to that. But as we go, that'd be really great. And I'll definitely open it up as well if you want to wait till the end. But so can you talk just a little bit about how you fell into optometry? You thought you were pre-med. Can you sort of take yourself back to that point in time? What led you to feel like maybe not pre-med and maybe something else?
yeah. So, I do have family members, um, who are involved in the medical field. And I think sometimes you think you want to do something, and then until you actually start doing the coursework and then kind of thinking about your trajectory in regards to your future and what that entails, especially, Hanover is obviously very academically demanding. You start thinking, okay, do I want to do this for another 13 years or 14 years? So that's kind of where my perspective came in. I'm like, you know what, I know I want to do something in the medical field, but also I want to have a family. And not saying that going into medical school doesn't give you that, but depending on where you land, sometimes you do have to make sacrifices in that regard. So I started to really think about what I wanted, and I knew I wanted to have a family and I wanted to be a mom. So I started looking at, okay, what kind of careers will allow me to have more of that 9 to 5, not really on call. And so that's basically what led me into looking at more um, a 4-year path after undergrad, instead of that 6 to 8 year path.
Okay.
So that's
We
where I
do have
started.
we have a great question in the chat. You just talked about 4 years. So optometry school is 4. You don't
Yes.
follow
So
with a
currently,
residency. Okay.
yes, exactly. It's 4 years, and a residency is optional. So,
Okay.
residency, what that would look like is maybe a year after optometry, special if you want to specialize in contact lenses or pediatrics or ocular disease. So, currently, that is optional. I know when I was in school, they talked about making that a requirement. At this time, it is not.
Okay.
So, um,
It's good to
I
know.
guess similar to, um, trying to think. I think isn't PA school. Some are 3, some are 4. Am I saying that right? Currently, like I said, optometry is 4 years. So,
Well, PA is 2 years. It's a
oh, is it
master's.
2 years? Oh,
Mhm,
okay, okay,
mhm. Some are 27, 28 months, but a little
okay.
over 2. Yeah. So we have a good question in the chat. What are the main differences of optometry and ophthalmology, and what do you think are the pros and cons of both?
So, as an optometrist, you go to optometry school. So we are a 4-year program, and our courses are specifically targeted towards the eye. So your first year, you're going to have general classes, and even, for example, some optometry schools are tied in with medical school, but that's the big difference. Ophthalmology, you will go to medical school. So you're
Mhm.
going to have 4 years of medical school, and then after that, then you're going to specialize. So um, if you're an ophthalmologist, depending on if you're a pediatric ophthalmologist or a retinal surgeon, or you focus on surgery in the front part of the eye, um, the schooling is different in that regard. And so I would not perform surgery. So the easiest example is a patient needs cataract surgery. So a cataract is just a clouding of the lens in your eye. So I would see that patient as an optometrist. I would diagnose them with the cataract and say, hey, this is visually necessary to have, it's affecting your vision. This needs to come out. And so then I would send them out to the ophthalmologist to perform the surgery. And then that patient would come back to me and I would do the post-ops. So um, the so one of the main differences is the schooling, the length of schooling, the capability, certain procedures. So I don't perform surgery. In the state of Kentucky, we have, so different states have different laws in regards to procedures that you can or cannot perform. So I do have, in the state of Kentucky, if you have a certain license, you can perform certain laser procedures on the eye. But for the most part, those are kind of the main differences. So ophthalmologists who go to medical school and perform surgery also are not going to prescribe, usually are not going to prescribe glasses or contact lenses. Um, and it's going to be a more specific, I guess, field of study. I'll see patients that are peds. I'll see babies that are 6 months old, and I'll see a 90-year-old, whereas most ophthalmologists are going to be more specific in what they do.
Sort of specialize or more focused on procedures. Okay.
Exactly.
Can you talk about just sort of a typical day in your work that sort of exemplifies the range of things that you might do? So, and maybe, what your work week is like, just sort of some practical pieces, nuts and bolts, hours, days, but then also the kinds of tasks and the variety of
Mhm.
those tasks.
So going to my point earlier, as a female at my company, Vision First, there is flexibility. So that was one of the reasons why I wanted to be an optometrist. So there are some optometrists that work 3 days a week at our company that are, and I'm not just saying, you know, women are the only ones who work part-time, but a lot of times, and that's the case. But anyways, so um, some will work 3 days a week, some will work 4 days a week. I personally still am working 5 days a week. I have a son who's going to be a year old this month, and hopefully, if we have another, I'll be able to go down to 4 days a week. But I do have that flexibility. In regards to hours, pretty much 9 to 5:30. Um, the great thing about, so whether you go into optometry or dentistry, you're going to see there's different modes, different ways that you practice. So I am at a private practice, which means that I have more um, flexibility in how I want to see my patients. So what that means is the practice does not tell me that I need to see 5 patients an hour or 2 patients an hour. I get to schedule. I choose how I want to see my patients. So for me personally, I graduated from optometry school in 2012, so I've been doing this for 10 years. So I have my schedule to where I will see, 3 full exams an hour, and then I'll see an eye problem. So if someone has metal stuck in their eye, or if someone's having an eye infection, that would be an eye problem. Um, every day our practice does book, an hour lunch break for our staff. And um, so, that's nice. Um, in regards to the type of things that we might see, like I said, each doctor has, things that they're comfortable with. So I am part of infancy. It's a program that, if you have a baby that's under a year old, I'll see them, and it's a free program to get their eyes checked. So I'm part of that. So I'll do those exams. I do a lot of medical, so glaucoma management. Um, so that's a disease that causes you to lose your peripheral vision, just routine exams. I'm sure you all have gone in. I don't know if anyone wears glasses or contact lenses, but you go in for your routine exam. So I would see you as a patient. In regards to our practice, we do work Saturdays. So that's something to consider. I think for newer graduates, sometimes, they have this idea that they might not work weekends, and for dentistry, a lot of dentists, I mean, I don't know if you've ever been to your dentist on a Saturday, but a lot of dentists do not work Saturdays. So we do work half day on Saturdays. And so, that, I think that's something to consider when you're looking to your future and what you want to do. If you're a nurse, you might work weekends. So as an optometrist at our practice, I do work half day on Saturdays. Any specific questions, I guess, in regards to?
Yeah,
I don't.
bring them to the chat for sure. Speaking of our dentist, I'm not sure what's up. I can only imagine maybe he has two little ones, some kind of family emergency. But I do happen to know that his practice has rather extended hours. I don't believe they have weekend hours, but I think they open as early as 7 or 7:30, which is
Okay.
pretty, so they're trying to catch people before they go into work. And so
Yes.
they have fairly long days. Am I the only one that's wondering how in the world you examine a baby and test their vision?
So 6 months is actually pretty easy, because at that point they can sit upright, but they can't walk around and, really swat their hands at you. But essentially, you don't have to have verbal cues. So not only with babies, but say patients that, have certain, um, like Down syndrome, or, they're 3 years old, they don't know their letters yet. So essentially what we do in order to check their prescription is we shine a light through the pupil, which is the hole in your eye, and we actually neutralize a reflex. It's kind of the old way of checking anyone's prescription. And so we use lenses and a light to neutralize a reflex, and that's what tells us what your prescription or a baby's prescription is. So, even though they can't read off letters, you can still check them and see if they need correction. And then likewise, you can dilate the hole in the eye and open it up real large and look inside, and examine the retina. And retinoblastoma is something that we check for. I know a while back there was a viral kind of story that went around, and essentially the mom took a picture of their baby's eyes, and someone noticed on Facebook that the two red reflex were not equal, and so that they found out. They took their baby to the doctor, and that baby had retinoblastoma, which is a tumor of the optic nerve. So anyways, you don't always have to have those subjective, cues. You can examine them that way.
Okay. I wanted to just note the fact that a woman, or maybe, a stay-at-home dad, or, very involved dad, the ability to just work, 3 or 4 day weeks is pretty amazing. We had our speech language pathologist that shared a few weeks ago indicated that she works 3 days a week, and she has 3 small children. And I just learned today that 2 of them are like twins, and I think they're like 3 and under. So
Oh, wow.
that's a great way to keep current in your profession and then dive back in when you're ready to do so full time. Would you say that's true?
Oh, yeah, definitely.
Yeah.
Um, I
And
mean,
I'm
there's so
I'm
many
not,
options.
go ahead.
No, go ahead.
I was just going to say, that's something to consider. If for a short period of time or periods of time, if you anticipate, wanting to do that, I'm not sure that all health professions would allow for that. But
Oh, yeah,
so you've
definitely.
sort of alluded to some things, but do you have some things that you just absolutely love about your profession, your favorite stuff, and then dish on what are the things that are not your favorite? No job is absolutely perfect. And what should these students know about optometry?
So one thing obviously I've spoke on is flexibility. Um, One thing I like about our profession is it's relatively clean. Like when I was shadowing dentistry, you're kind of, it's just a totally different. You're in people's mouths all day. So for me, that was not appealing. So ours is relatively clean in that. Hey, so, I mean, really the worst thing you're probably going to come in contact with is some eye discharge. That's some people that's not their cup of tea either. So it's relatively clean. Also, like I said, in regards to the flexibility, I probably keep saying that. But one thing I love about our profession too is that you can, I always tell patients the eye is the only place in the body that you can look inside without cutting open. So there are lots of health conditions that you can
Mm.
um, diagnose just by looking through a patient's eyes. I've had patients that are diabetic that did not know that they were diabetic. I've had patients with plaques. One of the arteries, main arteries that innervates the eye is a branch off of the carotid artery. So I've had patients that I've referred out to stroke centers to get evaluated because they have a little embolus in their artery that I could see. I've had patients with multiple sclerosis. I even had a patient not too long ago who was pregnant and didn't know it because that can cause changes in your vision. So
Oh,
that's one thing I love about our profession is you can still, you don't have to go to medical school to have that, sense of fulfillment in that you're helping someone in that regard. So I do love that about our profession. And like I said, I personally love seeing different age ranges. One one thing I will say is sometimes optometry can be monotonous, but the way that I personally um, I like to see different age ranges because I think it's less monotonous when you explore that. Some of the doctors in our practice do not like to see younger patients, and so I would say one of the things I do not personally love about our profession, I do not love checking glasses prescriptions. That's not my favorite thing, which is better one or two. But it's part of what I do. So that would be something that I guess that's not my favorite thing to do. Um, in regards to looking ahead, just it's so different now. Healthcare's changed so much. I mean, so many hospitals have merged together. Private practice isn't what it used to be. So I guess looking forward um, in regards to optometry specifically, um, I don't know where we're headed in that regard. So, and what I mean by that is with glasses, by being able to buy your glasses online, and there are apps where you can check your vision. Like, is it the same? No, but some people might view that as being the same. So, that does kind of concern me. But yeah, I guess one of the aspects of my profession I do not love is sometimes it can be monotonous. So I find ways not to make it be that way. And I do work at so there's different ways that you can practice. So if you're going into any profession, like I said, I'm in private practice, but also I work in two different locations. So I work in Louisville, so I did have a different patient demographic there as compared to Shelbyville, which is more of a rural practice. So I see a lot more disease there, and so that keeps things interesting, I suppose, and switches it up for me. So going back to your question about what my everyday looks like, I actually practice 2 days a week in Louisville at my Louisville store, and then I work 3 days a week in Shelbyville, and I love that. The company has approached me to work full time at one office or the other, but I love going back and forth.
Hmm.
So I'm trying to think. So other aspects. Any questions, I guess, over anything that I just went over there? Is anyone interested in optometry at this point, or no?
Potentially, is it on anybody's list? Well, here's your
It's
chance
funny
to.
because
Okay, so we got one
whenever,
maybe.
okay,
Yeah.
whenever between, honestly, I was the least likely person to go to optometry school. I don't wear glasses. I don't wear contact lenses. It literally was most of the time, most of the students that attend optometry school have some great story, and I did not have that great story. But interestingly, whenever I was at Hanover, I'll never forget Dr. Brunix was my advisor, and he did not know much about optometry. So really, I had to go out, research, kind of figure out, how do I apply to optometry school? What are the requirements? So I think it's really neat that you all have this class. I mean, essentially, this class um, is doing that for you. So that's nice.
Can you talk a little bit about the OAT? You took the optometry
Yes,
admission test.
yes.
Did you
So
feel like that was a huge, huge thing to prepare for, or not so much? Did you use like a course to prepare?
yeah, so I did not use a course. Essentially, what I did was I just studied MCAT uh, kind of
Mhm.
prep material, which is the admissions tests for medical school. And then there is, I think Kaplan, is that the, it's been
Yeah.
so long. So Kaplan had an OAT book that you could um, study, and I essentially use that. I will say a lot of it is having, like, I remember it was heavy, physics was heavy,
Mhm.
since we do study optics. It's optometry school is a lot of optics, so I had just taken that summer, so that was helpful. But yeah, I didn't take any specific class for
Okay.
it, but I think Kaplan does
Yeah.
offer. Do
Yeah.
they?
There's lots of test prep
Okay.
companies for the different
Um,
tests.
but yeah, I just used maybe the Kaplan OAT book, and
Okay.
I felt like Hanover too just really prepares you really well in regards to even optometry school. It wasn't necessarily that optometry school was hard, it's just the amount of material that you're expected to
Mhm.
learn. So in that sense, you should be well prepared no matter what health profession you go into. The science program was great, and I know it still is.
That's not the first time we've heard that kind of a statement as well. Can we segue just a tiny bit and talk about, were you able to look at the values activity and or exercise
Yes.
and just think about um, what's important to you, why, and how does that intersect with your choice of optometry? I'm guessing your values played a lot to do with it, and I'm guessing you're going to talk about flexibility because that's a huge one for me too.
Yes.
So, not to steal your
Yes.
thunder, do you have some other ones
Yeah, so
that
one,
rise
actually, I
to the
haven't
top?
looked at this. I'm just kind of browsing it now.
Okay.
I did print it out, but one of them, kind of off the bat, that I saw going down the first column is charity. So I was service chair at Hanover, and that's always been something on my heart that I do like to give back. So in regards to optometry, like I said, I am part of Infancy, which is a program that essentially um, I provide free eye exams for infants.
Mhm. Well, that's nice.
Um, I've also done a lot of overseas, just um, in optometry school, for example, there's a program called SFOSH. And so I went to Belize, Jamaica, Honduras, and we provided, we took tons of glasses with us, and we would perform hundreds of eye exams a day and send them, on their way with some glasses if we had their prescription there with us. And even now, it's not related to optometry, but my husband and I actually indirectly met through a nonprofit here in Louisville. So that is something that um, I think I've always had that on my heart to be involved with. And, you do have those opportunities in medicine to really make an impact no matter what you do. Um, there's some way that you can give back. In regard, let me look at the second column real quick. I mean, a lot of these are good, but so ethics, I think that's kind of goes hand in hand with anything in the medical field. Just, I think, thinking about going back to what I was saying between first and second year, like really just kind of thinking about, okay, why do I want to go to medical school? Or why do I want to do this? I think when you go into a profession, you shouldn't be led by, obviously money is huge. I mean, we want to provide for our families, we want to make a good income, but just ethics kind of coincides with like, why, deep down, why do you want to be involved in medicine? And so that's a huge part of my everyday is billing patients. So when I'm billing patients, making sure that I'm ethically billing them, it's not just to make money, but it's to, do it appropriately. That's kind of a roundabout to that. Let's see, and then the third column. Let's see. I like open-mindedness. I mean, in regards to, so I see a very heavy, especially in my Shelbyville practice, I have a very heavy Spanish population. And I'll never forget when I first started there. So I speak Spanish, and I welcomed all those patients. I'm glad everyone know I speak Spanish. And when the patients would first come in, there's like a hesitation when there's a language barrier. And one thing I always taught my staff is it doesn't matter. You don't have to speak Spanish. It's just making an effort to welcome them and give them the Spanish paperwork and let them know that you are here if they need help, even if it's just hola or whatever you want to say. So that is, something that kind of resonates, I guess, with me and what I do.
I think the language paired with the, health professional is huge. It really, I think, gives an edge in certain fields in particular. So, we've had students combine, a Spanish minor, say, with a science. I see a lot of that. I've had students in the externship talk about getting to translate at the rehab center, and how cool that was,
Oh,
and kind of
definitely.
give them a glimpse of what it would be like, to be able to offer that for future
And
patients.
Hanover I wasn't a Spanish minor, but I was close. So I took quite a few classes, and I mean, yeah, I agree. If you can speak another language, that's a huge untapped market and niche
Mhm.
that you can kind of grow for yourself. I will say I've definitely grown my practice in Shelbyville because of that. And
I bet.
and they're so grateful too, someone, and I'm not saying I'm fluent by any means, but I get by, and they are forever patients because they are so grateful that they found someone that can understand their needs and,
Yeah.
accommodate them the best that they can. So,
Yeah. Yeah.
And then let's see, I guess with the last column, relationships. So at this point in my career, I've been doing this I graduated in 2012, so it's going to be 10 years. Time goes by so fast. So I've been able to really build my patient base. And, I have those patients that come in and see me every year, and I just love that. So um, that is something with optometry, that it's not just in and out. I think some careers, like one of my good friends is an anesthesiologist, and, she has her case and the patient's out the door, and she likes it because she has that kind of instant gratification. Like there's a end result, I guess. She did her job, and, and then the patient's out the door. Um, Whereas, with what I do, it's kind of some patients I see every 6 weeks, some every few months, some every year. So I love that about what I do, just coming in and catching up with patients. And you do have that ability if you want to grow relationships with patients. So if you're a people person.
Can I ask you, kind of related to that? I don't know if you've taken a Myers-Briggs or whatever, but if you consider yourself more introverted or more extroverted,
Oh gosh, I've
somewhere in
taken
between.
this. So I am an extra, let's see. So what is it? It's like I'm an extrovert, but I also like my personal time.
Okay.
Um,
There's a
gosh, I can't.
term called ambivert, which like you are introverted in certain settings or extroverted in other settings.
Yes,
But
that's probably
and
what I
and
would.
I would think that optometry would lend itself to either. If you're kind of
Definitely.
introverted, it's a one-on-one mostly kind of profession.
Exactly.
So,
Exactly. You're not a college professor in front of tons of students. You have, like you said, that one-on-one more relationship. So even if you're an introvert, I think we do have and honestly, um, our practice is what they try to do is not only have different genders, but also because some people like to see a woman and some people like to see a man, but to have different personalities in that regard too. And it's funny, what patients, sometimes you just mesh better with certain patients. I'm not sure I understand. Oh, sorry about that.
talk about, did COVID really kind of do a number on your practice for a while, or were you able to sort of nimbly like uh, glide through, especially the early days, but some of the harder peaks? How has it changed, the practice?
So we were closed for 6 weeks, end of March through April. And we were actually performing telehealth visits, which
Hmm.
anyone who's gone to an optometrist knows it's very difficult. I had some, I think there's a corneal ulcer, but I can't see. So it turned into triaging those patients and sending them to be seen. It was basically, I mean, we
Yeah.
couldn't do much. So when we opened at the end of April in Kentucky, we were very behind. So for example, like I said, I have quite a few glaucoma patients. I see them every 3 months. So ever since we opened, I don't know, to me, it seems like we haven't stopped. We've been so busy. But then we also had those patients maybe that were older that waited to come in. And, some of my diabetic patients I was seeing every 4 months that maybe didn't need. So with diabetes, you can develop something called diabetic retinopathy, which is bleeding in the eye. If it gets to a certain extent, you need an injection or a laser. So I was monitoring those patients and they came in like, okay, your diabetes is out of control. You got to go, I have to set up a referral for you. So unfortunately, it was like some people put their health um, aside because they were just scared to come out and, get their eyes checked. But in regards to our practice, we were very lucky in that being in a large private practice, I had no stress at all because what I do is I come to work and I see patients. I don't have to do any of the, you know, filing insurance, getting credentialed, worrying about how are we going to pay the bills. So we have great people at the top that were able to, secure some funds. And I mean, for us, luckily, I mean, we were very blessed in that regard. I didn't have to ever worry about that, and our company did not. I can see being in private practice, if you're a solo practitioner, and I know a lot of kind of local practices, whether it be optometry or that closed because it was just too much for them to handle.
Yeah.
Maybe they were on the verge of retirement and they went ahead and retired. So for us, luckily, we didn't really feel a negative impact from COVID of all things. I feel like we got busier and busier, just like other health care professions. So
Yeah.
that was kind of our experience.
That's an interesting point about you're essentially an employee, correct, of this eye
Yes.
care group. Dr.
Yes.
Marty and his wife own a practice in Madison. And while it's really busy and bustling, and they have a staff of maybe 8 people, I don't know, something like that, the buck still stops with them. And that's a whole other ball of wax to consider. And even at our local, it's now Norton's King's Daughters Health. um, all of the doctors are employees there, and so I don't believe they do any of their own billing. That's all taken care of for them. But then I don't know, there is a independent physician who's not associated with the hospital. They would be putting out all of their own billing, in a practice like that. And so I don't know if you have anything else to add to that, but that's a whole other kind of thing to consider,
Hmm.
concerning a future career. Do you want to be on your own? Do you want to be a part of what other pros and cons would you say there are to be, say, a part of a large group like you're a part of?
Hmm. So when I first started, when I first graduated, I actually was in a different private practice, and I had planned on buying into this practice. So there was a solo practitioner. He had 2 offices. I thought it was a great opportunity to, he has 2 offices. One's not being utilized. The staff is there. We're not bringing another doctor, and utilize the staff, the space. Your overhead is minimal. Um, it was a lot of work. Um, when I talk about credentialing, so what that means is if you accept a certain insurance, you have to sign up with this insurance to be a provider. So I did that myself. So it was a lot. And then I'm trying to grow patients. I'm trying to do marketing for the practice because, he's an older, he didn't even know what Instagram was. So I made our Facebook page. I'm trying to do, as much marketing that I can, redid our sign up front. And it just got to a point where I was not seeing the growth that I would have liked. And, if you're deciding to go in with someone, they have to be on the same page as you. And that just was not the case. So my point being, it was very, in my personal position, it was a lot of work. And um, now I get to go in and I still get to reap the benefits of private practice, but I don't have to do all the work. I see patients, and um, we still have a level of decision making in that. Like I said, they don't dictate how I see patients or what contact lenses I recommend or what lenses I recommend. There's no push in that regard. On the other end of the spectrum, you could say, like, if I wanted to take my last patient at 3 o'clock, they're going to say no. So there's certain things that I don't. Um, I will say with our practice, if you can justify an expense. So what does that mean? So with optometry, there's a lot of overhead. We have devices that take pictures of the back of your eye that costs $60,000. We have a field machine that checks your vision that costs $30,000. So if you have your own practice, you're buying all of this equipment. So if there's a new piece of equipment, say for dry eye, that I think will help my patient, that will not put us in the negative, and I can prove that to them, they're pretty good about purchasing it for us. So in my position, I feel like I'm in a unique practice setting. Say, for example, some optometrists work at lens crafters. So they're independent contractors. That's another way that you can practice, even if you're a nurse. I think like a, well, no, that's not a good example. But anyways, what that means is that you, if you're an optometrist at Lens Crafters or Walmart, you have a lease, so you're paying for that space, and you get a percentage of what you bring in, essentially. You see the exams, you bill, you do it all. So I got off topic here. What was the question?
No, that's good to hear about that.
Okay.
There's sort of this in-between option as well.
Yes.
And it does sound like there are some real advantages if you don't want to think about that. Do you know Jerry Sudduth? Did you graduate near him? He
Is
was,
he a
I
vet?
think, yes, he's a
Okay.
Louisville vet.
Yes.
He may or may not present to the class, but I believe he got his MBA to
Okay.
be able to help, because at one point
Yes.
he was part owner of a couple of animal hospitals there in Louisville. And it's huge. Like it's like a whole nother job in addition,
Oh,
to what
yes.
you do. But if you thrive on that, and if you like being busy and you build a team, and you've got different experts doing different things, it could be a really cool challenge to take on. Oh, any other questions? Any questions? We had one good one. There've got to be a few other questions out there. Guys have any questions about Dr. Sarah's, I don't know, anything else about in college, in optometry school? I wanted to ask, well, you did talk about other careers that you contemplated. Was there anything else that you contemplated besides medicine?
No. I mean,
Okay.
just other careers, I suppose, in medicine. I thought about being a nurse anesthetist, but at the time, Hanover did not have a nursing program, so I would have had to switch schools. There's a nursing program, right?
Well, we
At
have
Han-
nursing partnerships,
Okay.
and we're actually looking into a BSN of our
Okay.
own. But a nurse anesthetist is a master's, and I think
Yes.
might be
Yes.
professionalizing to a doctorate as
Yes.
well. So,
Yes. So in that sense, could have graduated and done like a year advanced program in nursing, and then worked a few years. They like you to have experience, and then gone to um, get my nurse anesthetist, I guess, degree. I thought about podiatry, but yeah, everything was always, I guess, in the health
yeah,
field.
we do have one question. Someone asks for you to talk more about the process of schooling, and I'm not
Mhm.
sure, Maddie, if you want to specify what in particular you're thinking in terms of that question, like maybe the type of what's happening during year 1, year 2, year 3, and year 4. Is that what you mean?
Yeah, more like, I know she said residency during some of the years. Is it more like, we learned, I don't remember which occupation it was, but they had like 1 year of like book school, regular school, and then the rest is kind of like rotations. Is it more like that, or is it a combination, or more general school?
Mhm.
Good question.
So your first year of and obviously this is a little bit different depending on what school you go to. So I actually went to school in Memphis. I don't know if I said that. It's called Southern College of Optometry.
Mhm.
So it's not affiliated with a university. It's a private optometry school. So for example, Indiana University optometry school is affiliated with IU. So if you want to do research, that's also an option. Research is no matter what you do, if you go to medical school or optometry, you can maybe do research or do, teach. But anyways, so my first year of optometry school, it's usually kind of general courses. So anatomy, physiology, and some of the schools actually, for example, in Houston, you take those classes with your medical school students. It's the same class. And then the end of the first year, you'll take more specific like ocular physiology, ocular anatomy. But at the same time, all 4 years, you're still doing clinicals. So you're learning in first year your basic, just kind of chair skills, like when a patient comes in, what the pre-test physician would perform. So you're basically doing that, and then second year you're diving a little bit deeper into the more eye courses, and then you're still taking your clinicals, and we have 3 sets of boards. So you take your first set your second year, and that's at the end of second year, I believe. Third year, you are still taking classes, and you start your externs. So you have 3 rotations that you will do, and you'll start those at the end of your third year, and then you'll have 2 your fourth year. So the classes, you really don't have any classes your fourth year. It's just doing your externs. So I went to Colorado and did one. I did one here in Louisville, and then one in Memphis. And they're our school required, one that was like at a VA or I did one here in Louisville, what's called Bennett and Bloom Eye Center. So they're a huge referral practice. They have like 6 ophthalmologists. And so sometimes if you're an optometrist, you can work for an ophthalmologist if you want to just focus on disease. So you don't have to check glasses and contact lens prescriptions. That is an option. Some optometrists prefer to practice that way. But that's kind of the general, the entire 4 years, it's not just coursework. Your coursework kind of dies down, but you're always doing some kind of clinical rotation through the school.
Okay.
And then during your school, like how rigorous was it? Were you studying like most of your days and nights, or were you able to like have a job and a personal life?
I did not have a job specifically, but there were quite a few students that had jobs. It's a lot. It's a lot of, like I said, I don't think it's necessarily difficult, but it's a lot of hours. So that's what's at Hanover. You have units still. Is that kind of the case? You don't have hours. Okay. So I think in optometry school, we would have, what was it, like 28 hours. So one unit's like 3 or 4 hours, I think. So 28 to 30 hours of coursework. So like I said, it time management was huge. So I had some friends that had photographic memories, I suppose, and they would work, but most people did not work during school. And I will say, optometry school, I did have a social life, and I made time for that. I think to retain your sanity, you have. For me personally, I was not studying all the time. I was definitely, enjoying time with friends on the weekends, and we had different conferences we would go to. I went to Atlanta, Salt Lake City. So one thing I loved with your externs is you get to choose anywhere in the US that you want to go. So I was like, okay, this is my opportunity. I'm going to go to Colorado, explore. It was so fun. So, and then, like I said, we did have SFOSH, the volunteer group. So I did travel abroad a few times with that. So going back to the 4 years of optometry school, your coursework dies down your third and fourth year. So like I said, your fourth year, you're mostly just seeing patients. And then you have your final board exam, which is a clinical where you're seeing a patient. But yeah, I think it's going to be like that no matter what field you go into. It's just a lot of hours of studying.
Right.
So
there is one last question we'll take, and is there a lot of independence in your job? Alex, if you want to qualify that a little bit, you talk about flexibility, but what do you mean by independence in her job?
Like basically, like, are you working like kind of alone a lot? Like, do you get to do your own things, or do you kind of have to like report to somebody like a lot?
Mm-hmm. Yeah, there's definitely a lot of independence. So for example, today I was in Shelbyville. I was the only doctor there. So, when I come in, I'm basically telling the staff how to answer certain situations with patients, how to answer certain questions, fielding a lot of calls. This patient's having this eye problem. Do they need to come in today? Do they need to come in tomorrow? Your schedule's booked. So obviously we do have, in regards to reporting, above me would be, I guess they're not the owners anymore, but there are three kind of people that we report to, I suppose. But there's a lot of independence in what we do. For example, what I mean by that is if it's a snow day, yes, within our office, I did make the call the next day. Like, I think it's best. A lot of our staff lives in these small towns. Let's go ahead and just see patients from 9 to 12. Whereas the head honchos were like, you know what, we're closing all the offices. So I would not make that decision, but I could make that personal. Since we have so many offices, I could make those smaller decisions within my own practice. And then those larger decisions are going to be made by the kind of people above me. Does that answer your question?
Yeah, thank you.
Okay.
Lots of autonomy as the eye doctor, sort of at the top in that position. We are right at 8 o'clock. I regret that Dr. Marty didn't make it, but this was such a nice conversation with you, Dr. Sarah. Thank you so much for your time this
Yes,
evening.
you're welcome. Anytime.
And yeah, students, if you want to know more about optometry, I'm guessing Dr. Sarah would be open to conversations. Let me know, because this is one of these things where you don't know until you go, and we can arrange. I know, Dr. Sarah, you've talked about allowing some shadowing. This has been a year or so ago, but that might be a possibility going forward as well that we can check into. And certainly we've had students, we have a couple, I think, that are at IU School of Optometry who have worked locally. There is a practice that really likes to have Hanover students come work there. So I'm going to let everybody go. Have a great evening. And thanks to everybody.
Yes.
Good night. Thank you.
You're welcome.
Bye.